People of low socioeconomic status carry a higher burden of oral diseases, and this association remains across the life course from early childhood to older age and regardless of the country's overall income level. However, as Dr. Davis Ntulume, a dental surgeon, explains, the habit to ensure good oral practices is one we should adopt as we grow up. He says many of the dental problems he commonly sees are preventable and manageable whilst in the early stages.
Poor gum health, decay of the teeth. Decay is a multi-stage process. A small problem not attended to becomes a bigger problem to the very end where you might actually lose your tooth. And then there are other less common conditions like the cancers, like the wounds in the mouth called the ulcers. Those are also fairly common. And then with the advent of HIV, there are also other conditions that can happen in the mouth. We see this every now and then.
He adds that there are a number of misconceptions that people should know of and do away with.
Comes from pregnant mothers. When mothers get tooth decay, they are told as a misconception that you should not visit the dentist when you're pregnant. That is a very serious misconception and a gross omission, because we have seen mothers who have ended up in ICU with tooth infections. Sometimes people don't understand that a tooth can actually kill a person. If your tooth gets infected and the infection spreads from the mouth into the bone and into the circulation, you can actually get what we call a septicemia, a spread of infection into your circulation. And that one can actually kill a person.
Dr. Ntulume says brushing your teeth properly at least twice a day will prevent you from damaging your teeth.
Toothbrush abrasion is a fairly common condition causing sensitivity of the teeth. So we discourage the horizontal scrubbing of the teeth, and we try to tell people to go round and round in circles around their teeth. So the motion helps to still clean the teeth the same way, and you couple this with the up and down motion because you have to brush between all the individual teeth. Now, of course, that is cleaning the outer surfaces, but you also have an inner surface which you have to do the same. You can't go round and round on the inside, but then in this case you could do the horizontal and then the up and down to clean between the spaces. When it comes to the back teeth, don't open too wide. Then you're going to open gently. That moves the cheekbone away from the jaw and the brush can fit better. So there are adjuncts to cleaning. One of them is called dental floss. So what we need is we get some string off the roll, and then this is going to be rolled around the fingers on either side. And then you go between the teeth and you're able to clean. This is important because the toothbrush itself cannot effectively clean to remove food when it is stuck in there. So by using floss, then you are able to remove the food that is stuck between the teeth. And you have to go all around the teeth one at a time, cleaning in between. So you take it in, clean, and take it out. Take it, clean, take it out. For people who don't have artificial restorations in their mouth, when you have artificial restorations like the crowns, like the bridges in the mouth, then you take it in, clean, and pull it out as opposed to pulling it down.
Oral diseases encompass a range of diseases and conditions that include dental caries, periodontal or gum disease, tooth loss, oral cancer, among others, and they disproportionately affect the most vulnerable and disadvantaged populations. Walter Mwesigye, NTV.